medicine is continuously reinventing itself and rewriting the rules for aging and rejuvenation, and we're constantly reshaping the way we think about aging, pain, and the essence of vitality. And today we have a truly special guest, someone who's going to be with us who's reshaping essentially the landscape of healthcare and pushing the boundaries of regenerative medicine. Our guest today is none other than Dr. Harry Adelson, a pioneer in the field of regenerative medicine and the mastermind behind the groundbreaking concept of the total body stem cell makeover. And Dr. Adelson is a naturopathic doctor and has kind of dedicated his entire career towards exploring the potential of cell therapies, chronic musculoskeletal pain, garnered international attention for its transformative effects. And so, I love the fact that you are staying at the forefront of this. And today we're gonna get an insider's view as to what some of the potentials are out there, why we're doing it, and what we can expect in the future. Dr. Adelson, thank you so much for being with us.
Oh, Dr. Layke, thank you. Thank you for that kind introduction. It's so funny because of the spectrum of sort of the world of medicine. It's such a narrow slice that appreciates what I'm doing, because you've got all these conventional guys who are like, wait, what? A naturopath is doing what? And then you've got all the naturopaths who are like, wait, what? A naturopath is doing what? And so,
yes,
I'm just very, very pleased to be in an audience of people who actually appreciate what I'm doing.
Yeah, the interesting part is that in naturopathic medicine, we think of using the body's potential to heal itself. Well, what a better way of doing it than using our cells, right? And so, I think firstly, I kind of want to get into the history of how this all started. So you graduate naturopathic medical school. You are now out in a field and something has made you, the light bulb went on. Obviously, look, as a plastic surgeon, I often link regenerative medicine to the fact that we are slowly trying to make people look better, feel better, but age better as well. And so I think that's why I often link the two together. What was the impetus, or what was the spark that first you said, you know what? This is what I'm going to do?
I got into medicine initially. I did a wilderness EMT course when I was still basically a ski and climbing bum. And I just fell in love with the whole, I wanted to learn more. I wanted to take it further. And I looked at conventional medical school and it just didn't really feel like a fit. And at that time, I was very interested in sort of holistic nutrition before anybody even knew what that was. This back in the 90s. The early 90s. And so I got really sort of horrified by what was happening with the big food industry and how sick we were all becoming, and the obesity epidemic and the diabetes epidemic. And it really all boiled down to corporate greed. And I discovered naturopathic medicine, which is based on 6 guiding philosophical principles, which you mentioned. The first one is vis medicatrix natura, the healing power of nature. This concept that our bodies have the innate capacity to heal, and what can we do to unleash that power? So I went the naturopathic route, and I thought I was going to be a crusader against big food. I mean, what I thought I was going to do is basically what Mark Hyman is now doing. But in my 4th year of naturopathic school, I was completely fanatical about rock climbing. I spent all my extra time rock climbing, and I was training in the gym, and I did this cross-through move in the gym. I was training for a trip to France, the birthplace of modern sport climbing, and I heard this revolting pop in my shoulder. Oh man, that's not good. And I saw a surgeon, and he said, well, I can put a scope in there. I can cut away that piece of cartilage, or I can put some steroid in there. Either way, it'll probably help in the short term. It's probably going to give you problems long term. What do you want to do? And I was just like, seriously? Those are my only choices? So this was back in the 90s when doing research actually meant speaking to people. And I started asking around, and I found out about Rick Marinelli, who is pictured in right here. He was the first naturopathic doctor to do prolotherapy. And prolotherapy is the injection of natural substances, mostly sugar water, to essentially trick your body into thinking that you've endured a new severe injury, thereby launching the body's natural healing cascade. Very naturopathic. Back in those days, the MDs who were doing it were very much in sort of the alternative realm. Prolotherapy was never really accepted conventionally. And so they were very open and welcoming to the naturopaths. They just liked having more people, and we thought sort of the same way. I did that for a number of years and thought that was going to be my whole career. I thought that was going to be I was going to do the rest of my life. And then platelet-rich plasma came along.
That introduction was huge for sports medicine and chronic pain and things like that. And obviously, anytime we find anything that's good and we see some potential, then it works its way into aesthetics. And so obviously, I'm well versed in it now, but it was a big blow for joint repair.
Yeah, you bet. And so, PRP was a little more complicated. It involved the use of ultrasound because now instead of super cheap sugar water, we were using these kind of expensive kits to concentrate the platelet-rich plasma. So, it sort of became accepted to use ultrasound. So the naturopaths started doing that because that really seemed like a natural transition for us. But, also the orthopedic surgeons were doing it. And they were a little, like sort of looking at who are these guys? What are they doing? Did that for a number of years, and anything that prolotherapy could do, PRP could get it done in fewer treatments. Well,
Sure.
Then I had a patient who I helped for a number of years up to a certain point, but couldn't quite get her all the way there. She'd had this severe traumatic knee injury early in life that just never completely healed. And we'd helped her quite a bit with first with prolotherapy and then with PRP. And she showed up to my office with a stack of papers, dropped it on my desk. And they were basic science studies, mostly, I'm sorry, they were animal studies on the use of bone marrow stem cells for the treatment of arthritis. And she said, Harry, I want you to put bone marrow stem cells into my knee. And I said, Laura, I don't know how to do that. And she said, well, learn how to do it. I want you to do it to me. And I was like, Laura, I'm a naturopathic doctor. If I start doing bone marrow aspirations, do you know how much flack I'm going to get for doing that? And she goes, Harry, I'm an materials engineer for NASA and I'm a woman. So if you want to complain to me about people telling you that you're out of your league, I'm afraid you're talking to the wrong person.
Yep.
Now, will you please go learn how to do it? And I did. And it's actually not that hard to do. And I knew from that moment that was going to be the future of regenerative medicine. One thing led to another, and here I am.
And it's interesting because obviously bone marrow has been used for a long time and for its regenerative potential, using some of the mesenchymal stem cells, but also some of the hematopoietic stem cells. And we've been working on this stuff for a long time. And we've talked before. We have a clinic in Cabo, and we've delved into longevity and regenerative medicine. Tell me a little bit about how, again, I see the progression of what has been happening, but if we look at the early days of when you say, all right, we're going to do the total body stem cell makeover, right? So this is truly, this is a very novel idea. And the interesting part is, look, orthopedic surgeons, you're right. They've been doing injections into joints for a long time, whether it's, bone marrow, adipose derived, whatever it is, using different stem cells and PRP. But you do something a little different, I should say a lot different, which really sounds genius, right? I mean, the idea is we can always infuse stem cells, exosomes, nanoparticles. We can do these things into the system, and the hope is that they go to where your body needs it, right? But there are multiple studies showing that the direct and local injections obviously have a better effect. Maybe it's because of the perivascular stromal cells that are allowed to help repair once we kind of feed them that nutrition.
I think much more simply than that, it's really the laws of fluid dynamics and hemodynamics. You give something intravenously, first it goes to the lungs. If there's any cells in there, it's not going to pass the lungs, but it does dump all the growth factors. Then the growth factors go into general circulation, and then it just follows the path of least resistance. Most of it goes to the brain and the heart and the liver and the kidneys, and it follows the stream, and blood and musculoskeletal structures compared to those internal organs have very little blood flow, and intervertebral discs have no blood flow.
Mm-hmm. Exactly. And so maybe go over, how did this come to be? Because first of all, I want you to describe it, because I think you have a video that we can see that actually kind of shows the procedure. But I want you to describe this procedure to all those who cannot watch and they're listening to this. Now, when I say total body stem cell makeover, it is the total body stem cell makeover. Kind of describe what it is, how you came about, and how you've tailored it over the years.
Sure. So I'll tell you kind of the backstory of full body stem cell makeover. So when I started doing this bone marrow stem cells, I mean, this is back in 2010, 2011. I think
Mm.
I was about the 10th person in the US to do bone marrow stem cells. There were just very few people doing it. And back then, the only people in the United States who had heard of it were ranchers and cowboys. And the reason for that was because the very first adopters, the very earliest adopters of bone marrow stem cells were veterinarians. So these guys owned these very expensive workhorses who would get too old to work. They'd get arthritis in their hooves, and they'd effectively put them out to pasture. And they found this veterinarian who would do these bone marrow stem cell injections into these horses' hooves, and suddenly they'd get 2 or 3 more years of work out of them. And they'd
Wow.
look at that and they'd see it with their own eyes and they'd say, well, I want that for me. Can you do that to me? And then he'd say, I got arthritis in my back and my neck and my shoulders. And the guy would say, well, no, I can't. But I heard there's a guy in Park City doing it. Go to him. So in those early days, I started doing these cowboys. I started doing these dudes who were busted up, arthritis through their whole body. So I do their whole spine, and I do both hips, and I do both shoulders, and I do both knees. And John, as a joke, I used to call it full body stem cell makeover, just completely like as a gag. That was like
Sure.
tagline for it. Now, during those years, it was slow here because so few people had heard of stem cell medicine. I had a burn the ships approach. I stopped doing PRP. I stopped doing prolotherapy. I only wanted to do stem cells. So I would alternate months. I'd do 1 month here in the US doing these ranchers, doing these big treatments. And then I would alternate that going to Brazil. And it was hot in Brazil. There were lots of people
Wow.
who wanted it. And I would go down and they would, these doctors, these fabulous Japanese Brazilian doctors who had these very booming anti-aging practices would line up these days where I'd do 20 bone marrow procedures in a day and do low back and hips. So I had to get really efficient. I had to get to where, because when you do 20 procedures in a day, if you add 5 minutes to each
Yeah.
procedure, that's it. You just added 2 hours to your day. And
Yep.
so I had to get really ridiculously precise with everything that I did. And those two things combined, those alternating those two experiences, I suddenly got really good at injecting. I did it over a period of about 4 years. I got really fast. And what those rodeo cowboys will tell you is you got to go slow to go fast. I'll show you this video. It's a time lapse, but basically I did that for a period of years. Then I got Dave Asprey in here, and Dave Asprey, for your viewers, most of you guys probably know who he is. His goal is to live to be
Definitely.
180 years old.
Of
Then I got
course.
Ben Greenfield in, who I don't know that he wants to live that old, but he wants to be very physically active, very late in his life. And I
Yeah,
started
they want
getting,
to live well. That's the
yeah,
thing.
and the key to living well is just keep moving, just stay active as late as possible. Like Peter Diamandis says, die young, as old as possible, right? So
Mm-hmm.
I started getting these people saying, well, can't you just do my whole body in a single sitting? And I said, well, yeah, actually, I've been doing it for years.
And just to preface for everybody, so you are the owner and operator of Docere Clinics, which I thought, again, docere is a Latin term for to teach or instruct. I thought it's such a cool concept right there. But let's take a look at this video. I honestly, the first time I saw it, I was blown away because it's truly revolutionary. I want the viewers to really pay attention to what's happening. For the listeners, I'll kind of explain what
There's a
happens.
voiceover. There's actually a voiceover, so it's telling
Awesome.
what's happening. But this is a time lapse video. So this is a 1 hour long procedure that you're going to see in 1 minute, and I'm going to narrate in the voiceover. And I was a little bit sick, so my voice is a little rough, but you'll.
I'm going to explain to all the injections that we did during Ross's full body stem cell makeover. So first, I did epidural injections of stem cells. I put stem cells into the epidural space along his spinal cord. While I was doing that, Amy Killen was injecting Ross's scalp to thicken his hair follicles. Then I inject every facet joint, both sides, from the base of his skull down to his tailbone, the entire length of his spine. Then we turn him over. Then I do the major peripheral joints. So first I did the shoulders, we did the glenohumeral joints and the rotator cuff. They're using ultrasound. Then we did the hip joints, knees, ankles, great toe. While I'm doing that, Amy's doing the skin of the face. And then I come back, I do the elbows, the wrists, and the thumbs. And then to top it all off, in men, AB injects the penis to improve microcirculation. When we're treating women, she injects the vaginal tissue.
Just truly amazing. I mean, it's such a cool, you know, again, it may not be for everyone out there, but, you know, the one thing that I realized, and I'll just tell all the viewers and listeners right now, you remember when the first plasma screen came out and it was $10,000 and you know, only a few people could have it, and now they're, you know, $299. Right now, the ability to process cells, to truly purify and process cells and make sure that you have viable, donatable products, right? Those, it costs a lot of money. And so the idea is that, you know, right now, some of these things can be very cost prohibitive, but eventually in the future, I see this as being a little more commonplace, only because traditional medicine is so expensive the way it is. And this would essentially halt the progression. Think of how many back surgeries, you know, people with chronic low back pain. I mean, we ran into the narcotic issue, the opioid crisis, and most of it was due to spinal pain. Kind of give us an overview of pricing and, you know, how you've honed and tailored this procedure.
So, you know, just to kind of take what you just said, put a little finer point on it, you know, chronic pain is the leading cause of disability worldwide. The economic impact of chronic pain is equivalent. It's the same as heart disease, cancer, and diabetes combined. But chronic pain doesn't kill people. And so it doesn't get anywhere. For one, it doesn't kill people, so it doesn't get anywhere the research dollars that the big three get. But also, there's, you know, as conventional medicine goes, they don't see a simple answer for it,
Right.
or they don't see I shouldn't say it's not simple. They don't see a profitable. There's not really drugs for it. We've tried the drug route. It's been a mess. So really, it's like the way conventional medicine looks at it is drugs or surgery. And, you know, and stem cells really is like a middle route. And that's, it just doesn't fit into the model. Yes, it is quite expensive. Full body stem cell makeover is not for everybody. I mean, it's, you know, it's spendy. We used to do it with, for many years, I did it with bone marrow, combining bone marrow aspirate concentrate and stromal vascular fraction, which is the adipose-derived stem cells. Sometimes we would supplement with some extracellular vesicles, but mostly we were doing autologous from the person's own body.
Sure.
We did that for a number of years. Now, in the last couple of years, we've switched to using umbilical cord products, to using birth tissue products. These are ethically sourced and very thoroughly screened. Wharton's jelly, umbilical cord blood, extracellular vesicles. I use VidiLabs. I think they're the furthest along the regulatory pathway. I think they've got, you know, the best. The best product and the best operations as well.
Definitely. I mean, as far as their lab itself and the amount of data that they have. I mean, they're in so many phase 3 clinical trials and things like that. So it's really promising.
Yeah. You know, the thing that we can't do in the US that you can do in Cabo, for instance, working with VidiLabs, we're just using cells directly from the umbilical cord. We're using what are called naive cells. So it's fresh. They get it. They become in possession of the cesarean section derived umbilical cord. It goes directly to their processing laboratory. It gets frozen and doesn't get thawed again until I thaw it right before the treatment. And if anybody says, well, the cells don't survive the freezing process, well, then how do you explain in vitro fertilization? Because 100% of those embryos are frozen and you get a baby out of that, right? So the cells live. However, you're just sort of, you get what you get and you don't get upset. Like what's interesting is that, you know, through the study of chimerism, we believe that you're not going to adopt the negative traits from the DNA. So we're not too concerned about that. They're also very thoroughly screened. Vidi also, you know, they're very selective who they accept the tissue from. When you go to a place like Cabo and you work with a reputable lab, and I'm not talking about going to any laboratory in Tijuana or whatever, like when you go to a good lab, like the one you work with, like, you know, Panama, like a number of the organizations, what you can do there is you can take the cells, you can pick out the best ones, and then you can clone those.
Yes.
So my friend Tejas Azikar just gave me this. He's the medical director for Neil Riordan. He gave me this great example that he gives to patients. He says, if you want, 100,000, or if you want 100 million runners, like whatever, you take the population of California, and everybody can run, even a 95-year-old grandma can run somewhat. And you're going to get some really good runners in there, and you're going to get some not so good runners, but you're going to get, 100 million runners. Or you can take Usain Bolt and clone him 100 million times and get 100 million Usain Bolts. That's the big advantage to go to a place like Cabo, is in addition to, getting these large volume of cells, you're getting, a very select, excellent, excellently vetted cells. It entirely boils down to the quality of laboratory that you go to. And there's some really bad ones out there.
Definitely. It's interesting to me. We work with a lab that's really called ITC, and there are 10 COFEPRIS approved. That's the FDA for Mexico. There are 10 COFEPRIS approved labs there. And so ITC owns 5 of those 10. So they have the right formula, and the lab capabilities and the hematologists that are there with the PhDs that are backing them is, it's truly remarkable. It used to be that we would always say, it's kind of a joke saying, we're going to go get stuff done in Tijuana. But, our clinic is in Cabo, but believe it or not, Tijuana and Guadalajara and Cabo, they actually have some amazing cancer treatment centers, and, they're doing all this immune therapy. Without
a doubt, some of the best in the world, but there's also, they're mixed in with some of the worst too.
Exactly.
Buyer beware, do your homework. You can get good care there. You can get crappy care.
Yep.
To your question about the cost, so full body stem cell makeover is super exclusive. It's expensive. It starts at $65,000. The forehand, which is what I just described, where it's me and Amy Killen, it's 85 grand. Not for everybody. We have a tithing program where we do procedures at no cost for the medically underserved. We usually do 1 a month for people who qualify, usually combat veterans. In order to make this more available to between those two extremes. So the latest project that I'm involved with is Humanot Health, and you know these guys, and you've met all these guys. And so Jim Donnelly, who founded Restore Hyper Wellness, and a lot of your listeners have probably heard of Restore Hyper Wellness. There's like 250 stores in the U.S. I think they're one of the fastest growing franchises in the U.S. They do primarily cryotherapy, but also IV micronutrients and a number of other sort of light touch medical interventions. Jim was the founder of that, was the CEO. He stepped down, and his new project is now Humanot Health. It's just Humanot, like an astronaut, but a Humanot health.com.
Yeah, such a cool concept.
Yeah, and it's essentially, it's all the really cool longevity stuff, both the cutting edge, the latest diagnostics and interventions, mostly that insurance doesn't pay for, sort of all available in one place. This is not going to replace your concierge MD who's going to help you with stuff that comes up, but this is sort of helping you to formulate the optimal longevity protocol that's going to include regenerative medicine. It's also going to include a lot of hormones and different stuff. But what we're going to, make every effort to sort of take these treatments, not full body stem cell makeover, although they'll be sort of, it will integrate that in some capacity, but simpler treatments, people who need their low back done, people who need their hip done or something like that, will make it, much more affordable.
Amazing. Yeah. I think when it comes to that type of procedure, obviously, again, you have to imagine how, on average, let's say you're doing one of the full body makeovers, stem cell makeovers. What are the number of cellular products you use, meaning the number of stem cells or exosomes or things like that? Because I'm imagining that per joint, you multiply all of that, it's a significant amount. That's why it's, really, it's expensive from a cost standpoint.
It's expensive because it's huge quantities. So I use huge quantities. I don't really want to put numbers on it because that's one of the things that is sort of frowned upon in this country. We're using tissue products. These are birth tissue products. It does contain cells, but there's a lot of other factors in there besides the cells that are contributing to the treatment. The Wharton's jelly itself is the gelatinous substance that lines the umbilical cord. That's when the mother's making a baby, that's what the musculoskeletal structures actually are, the building blocks of that. So we use that. That's like the purest form of hyaluronic acid and collagen that there is. I mean, there are cells and there is a number, but let's see.
Yeah, I mean, but the idea is you've honed it down to a science, meaning
it's the equivalent of what people go to when you hear about people going to Panama or South America or Central America and doing these big, hundreds of million, big treatments. It's in that neighborhood.
That's amazing. Yeah, I mean, listen, I've spoken to Neil and Reardon, and it's interesting. They used to do a lot of autologous stuff, the hematopoietic stem cells, where you'd harvest. It's kind of what we adopted here. It's a lot of kind of Eastern and Western kind of put together. But I think most of us now are slowly migrating towards using, donor stem cells and exosomes. Here we call them tissue elements and nanoparticles. And really, listen, I've said this before, and we've had people on here that agree that ultimately I think our FDA is dragging their feet just because of big pharma. I mean, the idea is there's, as you had alluded to earlier, there's nothing to treat with a drug, and so there's no way to monetize this, and ultimately this may destroy traditional medicine as we know it. And so obviously, there's some fear on that side, especially for a multi-billion-dollar industry. I think one of the questions that often comes up from users or viewers and listeners, how do you approach kind of the skepticism or misconceptions about the safety and efficacy of doing a total body stem cell makeover or full body stem cell makeover? How do you approach that? Obviously there are going to be some docs and MDs out there that'll say, yeah, listen, I don't know that that's necessarily going to work. Or, how do you approach that?
I'd say, first of all, I don't try to convince anybody, because if somebody's already made up their mind, I'm not going to change their mind. So
Sure.
I'm not in the business of convincing anybody. This sort of appeals, like I like to say, it appeals to people from the Mick Jagger school of anything worth doing is worth overdoing. Mm-hmm. I've been doing this for years. I've been doing regenerative medicine now over 20 years. I've been doing stem cells for 13 years. And I've just seen that something that people will say was, well, if just my low back and my hip are bothering me, if we do all that other stuff, isn't it just going to like dilute the treatment? And I just haven't found that to be the case. If anything, there seems to be like a synergistic effect. Now, I don't know that with certainty. I haven't done any formal study on that, but I can just tell you from having done thousands of these, like it appears to work at least just as well, if not better. As far as the safety, anytime you poke someone with a needle, there's whether it's an acupuncture needle or any kind of injection, there's always a risk involved. And the risks are mostly with that. It's, of course, infection is a real risk. In over 20 years of practice, I've had 3 infections. One of them was serious. 2 were, not great, but everybody got through it. Everybody, managed through it. It's you stick enough needles in people, you're going to have infections. That's just the name of the game. Mm-hmm. Other than that, it's sort of just regular. Occasionally you get like a needle trauma or something. Had a few dural leaks that have self-resolved. Overall, like very, very safe. And if you look at the amount of good that we've done compared to the amount of like transient side effects, like overall, I think we're doing good work.
Yeah, listen, I think you hit it on the head earlier. It was that they're really, when you look at traditional therapies for musculoskeletal pain and chronic pain, that we don't have a whole lot. And so the very fact that this is a potential, I just want, certain people that are listening and viewing this, that they consider this as a potential option for them. I mean, the Docere Clinic is located in Park City, Utah, which is absolutely phenomenal. You just showed me a little bit of the surrounding from your office, what you get to view on a daily basis. And so I see why you are a happy guy. And, I just feel like this is where medicine is headed. And, I'm excited because I get to witness this next week. And so
next week, you're going to be here next week.
Yeah, I'm so excited. And again, in 2 weeks, it's the big 5-0 coming up. So I'm going to have to lay on that table and start getting some injections. So, like I said, I think this is definitely where medicine is headed. As far as maybe some closing thoughts, what are some final thoughts or advice you would give individuals? Let's say they want to search out more information. Where should they go? When you explore regenerative medicine, as we mentioned in Mexico, there's good and bad, and unfortunately, it's hard to discern between the two. What would you tell the viewers or listeners? How should they go about? Let's say they're interested in doing this. What's the first step?
Well, okay, so if we're talking about like a low back pain or joint pain or something like that, first you decide sort of whether you're willing to travel, whether you want to stay local. And then, if you're choosing a provider, I mean, there's a lot of things you want to consider. Anybody who is over promising, like just like if somebody's giving you, like if they're making a sale, I'd avoid that. Like that's a huge turnoff. Like if you look at my website, it's one giant disclaimer. It's basically just saying, hey, look, this might work, it might not. We've helped a lot of people. We've had people we haven't helped at all. So like right off the bat, if somebody's just like telling you that they're definitely going to help you, that run the other way. And then, it's largely like looking at their experience. I mean, I'm not formally trained. I learned all this sort of started out as prolotherapy. Like, so I don't put a lot of stock into whether or not somebody has, formal this or formal that, but what their experience is. Then, if they're using birth tissue products, which lab they use, if they're doing autologous, what system they use. I definitely would, you want somebody who's using imaging. Like you don't want somebody who's just kind of palpating around.
Yeah.
Because like even the best injectors miss a lot when you do it that way. And that's been proven. Like you need to see where you're going. Like you need either X-ray or ultrasound, and ideally both. I have both. And there's some things that X-ray is great at, and there's some things that ultrasound is great at, and there's other things you can kind of use either. And there's some things that you really need one or the other. So you want to make sure the person does imaging. And I think a real differentiating factor is whether or not they offer sedation by an anesthesiologist, because if they offer it, even if you don't do it, like if they offer it, it shows that a level of seriousness.
Definitely.
Because there's a bunch of hoops you have to jump through, and it just shows that like these guys are like they're ticking all the boxes as far as
legitimate and trained enough to ensure safety.
Yeah.
And that's I agree with you. I think that those are some key things. You can go to Docere Clinic's the website, and it's interesting.
It's only one giant disclaimer at this point.
Yeah, I thought it was very informative, and I love the videos. And there are some short videos and longer videos that kind of show different patients' experiences. And again, it may not work for everybody, but the idea, the concept is true. There's enough data to show that what you're doing works. It doesn't work on everyone. And I think with regenerative medicine, it's one of those things where we're essentially selling hope. I mean, that's ultimately it. And the hope is that it does work for you.
But if you're selling false hope, you don't last very long.
Very true. Very true.
I've seen a lot of clinics come and go. And if you're BSing folks, like you don't stick around long.
Yeah, it's interesting to me watching these clinics that treat every single disease out there, and I'm thinking, these are some broad blanket claims, and you're going to wind up in a world of hurt if you go down that pathway. So I think I agree with you earlier. I mean, you want to properly vet the clinic, the particular clinic, and ensure the questions you should ask are, where do you source your cells? And that way you could do your own research if you prefer. And then the level of experience of that particular practitioner. So again, I'm curious, where do you go from here? We've kind of talked on the side, but for the viewers and listeners, where do you go from here? I mean, you're at the pinnacle of your career. You have this total body stem cell makeover. You've got every celeb and athlete and VIP coming in there. What's next? What's on the docket?
Well, the big push is for Human on Health. I mean, Human on Health is very exciting for me because it's going to fill a need. It's going to really bring it to the people in a manner that, I mean, it's going to be a franchise model. So it's going to be in a manner where you're going to get consistent care whichever location you go to. And our hope is to roll it out to the entire country. And it's going to be a broad spectrum of care delivered I'm working with Amy Killen. Amy Killen is the medical director. I'm the director of regenerative medicine. She's in charge of like all the other stuff, which is there's going to be a lot of other stuff. And Jim Donnelly is, he's a visionary. Like, it's amazing.
Yeah, he's definitely up there, and especially that type of franchise model. I mean, it's just.
I plan for that to be hugely disruptive. And then, I think the hope is to sort of roll Docere clinics into Humanot, where it'll be a place for people who want, sort of higher end stuff. We'll be able to do that. And then, of course, I want to come work with you in Cabo. I want to be able to do this with the same cells that you're using down there. That'd be great.
Awesome.
Kite surfing.
Yeah, exactly. Well, there's plenty of that down there. Listen, I know you're a busy guy. I definitely appreciate the fact that you took the time out today and you educated me, and I know you educated who's listening and watching this. Again, for those of you who are interested in this, I would definitely go to the Docere Clinic's website because it's informative. It walks you through the entire process, and it also gives you potential contact information and on how to get started with this. Some people you've truly changed people's lives, and when someone can say that, it always allows you to sleep better at night and feel good. I mean, that's just one of those things in the practice of medicine. So, I applaud you for that. I definitely respect you, and I know that there's a lot that I can learn from you. So thank you so much for spending the time with us.
Oh, you're most welcome. It's been a pleasure, and I look forward to seeing you next week.
If you like this video, you're going to love this one.
It's a platform technology, which means we can turn this baby stem cell, which we've taken from your skin or from someone else's skin if we're using a donor, and we can essentially turn it into any cell we want. We can turn it into cardiomyocytes for the heart. We can turn it into dopamine-producing neurons for Parkinson's.